Thank you for having me. So this was a study that was done on the drug Cangrelor. It's an intravenous platelet inhibitor. It has been shown to improve the outcomes of patients who are undergoing percutaneous coronary intervention or PCI in the Champion Phoenix trials. So what we tried to do is to see its impact on primary PCI done on ST elevation myocardial infarction patients. We were specifically interested in its effect on inflammatory markers and its effect on infarct size. So we started an exploratory study. It's a very small pilot study where we randomized patients presenting for primary PCI to Cangrelor versus placebo infusion. Both groups of patients were getting baseline ticagrelor orally as a P2R12 preloading, in addition, obviously, to aspirin. So one group was Cangrelor intravenously at the time of the procedure, plus ticagrelor given immediately before the procedure. And then the other group was placebo infusion plus ticagrelor given immediately before the procedure. And all patients were receiving aspirin in the ambulance as the standard of care. We then looked at platelet function testing. We looked at baseline platelet function and inflammatory markers. We looked at platelet functions and inflammatory markers at the end of the after 10 minutes and at the end of the procedure. And we looked at 6 and 12 hours and 24 hours as well. As far as imaging, we did an echocardiogram at 48 hours, and then we did an MRI at 48 hours and an MRI at 3 months. The intention of the MRI was to measure infarct size.